Osteoporosis causes deterioration of the bones, which results in many complications, including compression fractures of the spine. We talked with Dr. David Duffner of Desert Regional Medical Center in Palm Springs about a new procedure which can restore the spinal height and reduce the often severe pain.
Osteoporosis is weakening of the bones. The bones provide structural support for the body. Bones are a composite material. They're made of collagen, which is the same type of material that's in any connective tissue, skin or tendons or ligaments. But in bone, it's strengthened by calcium. And what happens is that as people age, the calcium decreases. The calcium content of the bone decreases. Typically, most people lose about 1% per year after age 40. In postmenopausal women, that's accelerated to about 1.5% of the bone mineral density per year. So it adds up over time. And if the calcium is not replaced, then the bones become weakened. When osteoporosis becomes severe, people experience what we call fragility fractures. In other words, the bones become fragile. A bone can actually break when you fall, or it can snap before a person falls. What we find is that the painful spine can really stop a person's life. And when they are not able to be active, it creates a downward spiral where their whole system deteriorates, not only their musculoskeletal system, but all the other systems in the body because they're not active. So we find that it's very important to relieve pain and get a person back to activity. It's important not only for quality of life, but actually longevity, because people that have these compression fractures that are not active actually don't live as long as a person the same age without this condition. Over the last 5 to 10 years, there have been dramatic improvements in our ability to treat these types of spine compression fractures. In the past, we have not had much to offer. Doctors would typically recommend pain medicine and bed rest and sometimes a brace. The braces themselves are quite uncomfortable, and most people really don't use them very well. And we have not had much else to offer. Most of these patients do not need open surgery. But what has happened in the past 5 or 10 years is that new techniques have emerged for a minimally invasive approach to strengthen the spine with bone cement. Bone cement has been used safely for 50 years now in doing hip replacements and knee replacements. So it's the same material that's used in reconstructive orthopedic surgery. Now we can insert it into the spine through a small device with a very tiny incision and fill the weakened bone with the hard bone cement. And this does a couple of things. One is it stops the motion in the vertebrae, the collapsed vertebrae. It can freeze it to stop the motion, and that stops the pain. And there is a technique of inserting a device that can expand inside the vertebral body to raise that end plate and restore the vertebral body height, so it actually decreases the deformity. And it creates a void, and then that void can be filled with cement to make it strong again. This is really exciting new technology that continues to evolve. But I think that over the next 10 years or so, we're going to see more biological type of material where it can actually turn into bone, and the bone can actually heal itself. And so we won't have a permanent implant. We'll have something that will fill the compressed vertebral body, stop the motion, stop the pain, allow the patient to become active again, and eventually heal with bone.